So we need to talk about medical racism and the very real, very measurable harm it has on Black communities. A stunning study just published Tuesday in the Journal of the American Medical Association revealing that there were more than 1.6 million excess deaths of Black Americans the past 22 years compared to white Americans. This isn't a conversation about genetics or behavior. It's about the environment of historically redlined communities. It's about unequal health care access, and it's about the actual quality of care that Black patients are receiving. For one of the most glaring examples, just take a look at maternal mortality worldwide. Maternal mortality. UNICEF says about 21 of every 100,000 mothers in the U.S. die in childbirth. That's less than Mexico's 59, but more than Canada's 11. Now, if you pull apart those numbers, though, you're going to see how unequal the burden is. The Kaiser Family Foundation, and pretty much every study on it, finds Black women have the highest risk of dying in pregnancy and childbirth, leading the country with more than 41 deaths per 100,000 births. Joining me now, the perfect person to talk about this is Dr. Uche Blackstock. She's the founder and CEO of Advancing Health Equity. She's an MSNBC medical contributor and the author of the forthcoming book, Legacy, a Black physician reckons with racism in medicine. It's due out in January of 2024. Dr. Blackstock, I had to have you on to talk about this. We were just talking during the commercial before this segment started about how naively I used to think that there were areas of life that you would never expect to find racism. And I always thought a place like healthcare, medicine, supposed to be colorblind. But how naive am I to think that that's the case?
I know, Katie. I mean, and then as I replied to you, I said, healthcare is a social institution just like employment, just like housing, just like education. And we see how embedded racism is in all of those other social institutions, that it is to be expected that it also be in healthcare. And we also have a history in this country. I mean, history from slavery forward of racism being part of how medicine and healthcare is practiced, even starting from slavery when enslaved Black women were used, actually experimented on to develop new surgical techniques.
So you are an amazingly accomplished mother and physician. Your sister is a physician as well. Your mother, physician as well. All of you graduating from Harvard. But you guys are unicorns. We talked about this. A UCLA study finding that the proportion of U.S. physicians who are Black, only 5.4%, an increase of only 4 percentage points over the past 120 years. How much does the lack of representation, even in the physicians and the caregivers, how does that affect what we're seeing in medical racism?
And Katie, those numbers are staggering. Like, you would expect more progress to be made.
Over 120 years.
Yes, and I would say it's even more concerning for Black male physicians. The numbers actually have gone down since the 1960s. So fewer percentage of Black male physicians. And I think what that tells us is there's a problem with the pipeline. And that pipeline of creating Black health professionals needs to start from as early as possible, from even pre-K, nursery school. We need to make sure we're exposing young people and children that this is a possibility, but also giving them the resources, the mentorship and sponsorship to help them get through that pipeline. We know that having Black physicians and other health professionals makes a difference. We know that it improves people. People are more likely to take their medications. They're more likely to follow their doctor's recommendations. They're more likely to feel seen and heard and appreciated during their doctor's visits.
Speaking of doctor's visits, this was wild to me and really alarming. 41% of Black patients making a point of showing that they're educated when they go to visit with a doctor. 35% code switching, meaning they change their speech patterns or their behavior for the doctor's comfort. And 32% pay special attention to even how they dress. So we actually have an impact on communities of color, especially Black communities, in the way that they're even presenting themselves in order to obtain necessary health care?
It is so heartbreaking. And Katie, I will tell you this. I, as a patient, do the same thing.
Wow.
And I am a physician, but I always want to make sure when I go to see a new health professional that they know I know what I'm talking about, that they know that I'm not just walking up the street. Right? And there have been studies just like this that show, and actually it doesn't even really end up making a difference. Like, you could do all that you can. You could try to code switch. You could make sure that you're dressed neatly, put on your best dress. And actually, it really doesn't make much of a difference with health professionals. They're still going to have those embedded biases. Just because you go into healthcare and you want to do the right thing doesn't mean you always do the right thing. right? You have to be intentional about recognizing your own biases and also recognizing what are the social factors that are influencing your patients' lives. Like, why are they coming in with these chronic medical diseases? It's not just because they're not eating well. It's because they live in food deserts. They lack access to quality and culturally responsive care. You know, we have to think about all of those external systemic factors instead of blaming the patient.